Hospital emergency departments are dealing with an increasing number of people experiencing mental distress.
I think EDs have become kind of like the de facto health service for so many people, including people experiencing, mental health challenges.
Should it be like that?
Hell no.
A report on patient safety concerns at Middlemore Hospital's ED last winter gives an insight into the issue. In just over 1 month, 5 patients were documented to have absconded from the ED. 1 attempted self-harm immediately once outside.
We generally have watchers on patients, but if they're very quick and run out, then it can be challenging, and we don't like our staff to leave the emergency department. We normally call the police to pick those patients up. And we do have people abscond every day, not just on busy days. Any day a person who's determined to get out can get out.
I would say that there is absolutely many examples of patients who are under the Mental Health Act, shall we say, who have absconded from emergency departments because of an inability to continually watch them while they were there.
And that's because staff are so overrun?
Yes, staff are overstretched because the ED is running at very high capacity. This is an example of what's happening in our departments every day, and that's an example of patients who are spending typically very long times in emergency departments waiting for an inpatient bed.
Sean Robinson is the CEO of the Mental Health Foundation.
5 patients absconded from the ED during a period of just over a month, one of whom attempted suicide as soon as they got outside the ED door. Does that surprise you?
Look, sadly, no.
He says in many cases, the ED is the only option.
What we need are a range of alternatives in the community. I mean, a lot of those people, if they could go to a centre in the community where they could get appropriate support and the de-escalation of that situation, they probably never need to go into hospital.
So we don't have the experts or the facilities out there to assist those who are most in need?
Yeah, absolutely. We just don't have the range of services, and we don't have enough of the different types of staff and experts that we need to fill them.
It's a sentiment shared by psychiatrist Dr. Hemant Thabru, who's chair of the Royal Australian and New Zealand College of Psychiatrists.
We know that ED is a default point now for accessing mental health care because people seem to not have anywhere else to go or no other way of getting help when they are experiencing mental health difficulties. We know that EDs play a vital role in stabilising people in crisis, but they were never built or resourced to deliver sustained, culturally safe mental health support.
Police have stopped attending mental health call-outs unless there's a risk to life or safety. Mental Health Minister Matt Ducey announced $28 million to set up 10 new mental health response teams to attend 111 calls. But Thabru says the budget failed to deliver in other areas.
For this government, they're halfway through their current term and we haven't seen any real plan to address this mental health crisis. We've seen no comprehensive strategy, no dedicated roadmap, and there's no urgency to meet the scale of need. Mental health investment to date, to us, seems to have been very patchy, poorly planned and reactive.
UNICEF says when it comes to mental well-being, New Zealand ranks the lowest out of 36 OECD countries.
We have, once again, the highest youth suicide rate, despite apparent investment into mental health services. So this should be a national emergency, but instead we're seeing these patchwork announcements, like I said, instead of structural reform.
Robinson says he supports the minister's efforts to expand the workforce.
Look, I do have to back the Minister of Mental Health, our first Minister of Mental Health, Minister Ducey. He has set targets for training of health professionals. He's also been really creative and looked at how to expand the workforce in areas like peer support.
Peer support workers help people facing distress or addiction when they turn up in EDs like at Middlemore. But like Thabru, Robinson wants to see a comprehensive plan.
Has this budget delivered a clear strategy or vision for mental health services in New Zealand?
No, it hasn't.
Minister Ducey told the Herald a mental health strategy will be released in October this year. Keep up to date with the latest New Zealand Herald news by hitting the subscribe button below or head over to nzherald.co.nz.